Hey everyone! Today, I'll be delving into the topic of reversing type 2 diabetes, solely through dietary adjustments, and that's coming up next. Back in 2019, the American Diabetes Association issued a consensus report on nutrition therapy for adults with diabetes. Essentially, this report is the culmination of efforts by top scientists who congregated to determine the strongest scientific evidence regarding diet. And here's what they came up with. They acknowledged that a variety of dietary patterns could be beneficial in managing diabetes. However, there are a few key principles they emphasized. These include focusing on non-starchy vegetables, cutting down on added sugars and refined grains, and opting for whole foods. Moreover, another significant recommendation from these experts is that reducing overall carbohydrate intake for individuals with diabetes is the most substantiated approach for controlling or even reversing type 2 diabetes. In other words, a low-carbohydrate diet is possibly the most effective strategy, according to these authorities, for managing or reversing your type 2 diabetes. And I'm about to show you exactly how that works. To grasp how this diet functions, it's important to understand why people develop type 2 diabetes in the first place. Notably, type 2 diabetes is actually a reversible dietary disease, although this isn't widely acknowledged. For instance, organizations like Diabetes Canada describe it as a chronic progressive disorder. However, it's well understood that weight loss almost invariably improves or even eliminates type 2 diabetes. The disease itself is relatively straightforward to comprehend. Essentially, it boils down to having excessive sugar in the body. This includes glucose, found in starchy foods, as starches are glucose chains, and fructose, present in simple sugars like table sugar or fruit. When your body accumulates too much sugar, both glucose and fructose, and can no longer store it, this excess spills into your bloodstream. Once your blood glucose levels begin to climb, that's when your doctor is likely to diagnose you with type 2 diabetes. Essentially, it's an overflow issue. Therefore, a logical approach if your body has an overload of sugar is to decrease the amount of sugar you consume. Hence, a low-carbohydrate diet is quite rational, as it shifts your intake from sugar-laden foods to those higher in protein and fat. These nutrients may contain calories and other nutrients, but they lack substantial glucose, which is the crux of the problem. Recently, Dr. David and Jen Unwin in the United Kingdom published an intriguing study on how they utilize low-carbohydrate diets in their practice to reverse type 2 diabetes. Dr. Unwin are celebrated clinical innovators, recognized by their medical community. They observed that from 1987 to 2018, there was an 8-fold increase in the prevalence of type 2 diabetes. Thus, since 2013, they began offering low-carbohydrate diets as an alternative to conventional medications. Not everyone embraced this advice, but they found that 27% of their patients did. They provided these individuals with easy-to-understand dietary guidance and simple infographics and monitored them over time. The outcomes they documented were remarkable. Over the period during which these individuals followed a low-carbohydrate diet, they lost an average of 8.3 kilograms, over 18 pounds, and significantly reduced their medication use. Impressively, 46% of type 2 diabetics actually reversed their condition, so they were no longer considered diabetic. In cases of prediabetes, the results were even more impressive. 93% of those who followed the low-carbohydrate advice successfully reversed their prediabetes to become non-diabetic. Remember, if you are currently on medication, please make sure to consult with your doctor first and follow up during this process. Here's a straightforward one-page document that patients were given detailing the dietary guidelines they should follow. The rules are pretty simple. First up, sugar, eliminate it completely. Next, let's talk about starchy carbohydrates. Remember, these break down into glucose, which is a sugar. So try to substantially cut back on things like bread, rice, and potatoes. On the other hand, green vegetables are all good. You should eat as much of these as you like. Think about swapping out the white foods for more greens to still enjoy a fulfilling meal. Fruit gets a bit more complicated. Some fruits are quite sugary, hence have more sugar. Others, like berries, are generally lower in sugar, and you can be a bit more lenient with them. Ensure you're eating plenty of healthy proteins, such as meat, eggs, fish, oily fish, and full-fat yogurt, which are all solid options. When it comes to fats, moderation is key, but stick to natural fats like olive oil, butter, and coconut oil, those that come unprocessed. Watch out for low-fat foods. They often contain high amounts of sugars and sweeteners. Cheese should also be consumed in moderation, as it's very easy to overindulge. Another important guideline is to avoid snacks. They can be incredibly habit-forming, and it's all too easy to consume them mindlessly, leading to overeating. Fundamentally, by consuming lots of vegetables along with proteins and healthy fats, you will feel sufficiently full in a sustainable way, which naturally reduces the urge to snack. Regarding sweeteners, just cut them out. They trick your brain into thinking you're hungry, complicating your weight loss efforts. This is straightforward, standard advice that almost anyone can adhere to. They also provided an infographic showing the sugar content in various foods to emphasize how much sugar they contain and why it's crucial to avoid, particularly the very starchy ones. That's about all there is to it. If you can transition to cutting down on carbohydrates, focusing on green, non-starchy vegetables, proteins, and healthy fats, then you have a solid chance of reversing type 2 diabetes. Remember, understanding type 2 diabetes isn't too complex. Think of it like a rain barrel. If you fill it up too much, it's going to overflow, just like sugar in your body. The best approach isn't to constantly clean up the overflow. The best approach is to turn off the tap. By doing so, you stop the influx of sugar into your body, leading to a decrease in blood sugar levels and ultimately a good chance of reversing type 2 diabetes. Thanks for watching, everyone. I hope you found this information helpful. If you did, perhaps share it with a friend who might benefit from it too. And if you could, please hit that like button so more people can find this video. Thanks a lot. We'll see you in the next one.